So next up, we have Dr. Maja Joosten and Dr. Joyce Manibakia from the Netherlands, and we're going to see their presentation on training of the steps of the transanal endorectal pull-through on a take-home simulation model. Afterwards, we'll hear from Dr. Simon Eaton from UCL Grey Ormond Street Institute of Child Health. So let's take it away with that presentation.
The transanal endorectal pull-through, or TURP procedure, is a common surgical procedure in the treatment of Hirschsprung's disease. The TURP consists of several component steps that require a structured approach. Sufficient training is needed to acquire the skills to perform this procedure. However, given the relatively rare nature of Hirschsprung's disease, this can be challenging. Our aim was to evaluate the use of a low-cost model for the training of the TURP procedure. A low-cost, three-dimensional model was developed. A reusable wooden frame serves as its base. The perineal body consists of a sponge. A silicone top layer mimics the skin, and a multi-layer balloon design simulates the different layers of the rectum and mesorectum. Participants were recruited during the Pediatric Colorectal Surgery course in 2020 and 2021. Participants were invited to use the model to practice the different steps of the TURP procedure systematically, as seen in this instructional poster. From placing traction sutures, to performing the anastomosis itself. Both expert pediatric surgeons, experts and residents and fellows, the target group, were asked to complete questionnaire rating the realism, didactic value of the model, and the use in a hands-on workshop using a 5-point Likert scale. There were altogether 18 participants, 2 experts and 16 participants in the target group. The model scored well on haptics, visual aspects and realism, with a median score of 4, and with a median score of 4.5, the model scored even higher as a good tool to train the component steps of the TURP procedure. Participants regarded training on the model as a valuable use of time. The model was not only considered to be a useful exercise during the workshop with a median score of 5, but also regarded to be suitable for repetitive practice at home after the workshop. In conclusion, participants regarded this reusable take-home TURPS model as a potent training tool for the component steps of the TURP procedure and as a suitable model for preclinical workshops and repetitive practice at home. Enjoy your training!
So this is a very interesting paper, and obviously simulation's an important part of pediatric surgical training now. But sometimes this is difficult because of the inaccessibility of the training rigs. However, this is clearly a bit of a game changer in that you can take it home, which makes it accessible to not only to trainee pediatric surgeons, but also to other countries around the world that may not have access to these simulatory tools. So I'm going to ask some quick fire questions here. Ultimately, obviously, the success of this in terms of training is only a success if it actually improves people's experience when they get into theatre and when they actually operate on real life Hirschsprung's patients. Do you have any feedback on whether people actually who had been on the trainer actually found it useful when they were actually operating on a patient?
Well, thank you for these very lovely compliments. That is the next step indeed, because for this model, as of yet, we haven't yet transferred it to the clinical setting in the sense that we've developed a formal critical assessment form where you can extrapolate your advances made on the model to evaluating your functioning in the operating theatre. So even though we have asked people how confident they feel going forward, having had this training, that is the next step, using a critical assessment form to actually see how it improves people's operative functioning and also operative confidence.
And what was the feedback? I saw that you had 2 experts who had used this at your training course. Was there some specific feedback from the 2 experts as to what the fidelity was like in the model?
Well, we have since elaborated our study so that we've included more experts. So currently our 5 experts, where the main feedback is that just the suitability of the training for the training of the different steps of the procedure, that's the true strength that this model has. That is a good tool to train the component steps. So that's the most heard feedback, mainly from the experts.
And a question regarding this is that, can you train too much on this? I mean, if you're so expert on this particular setup, does that mean that actually when faced with a real procedure, you're expecting something that's quite different in terms of haptic feedback, et cetera, and actually it is a point at which you've trained too much?
Well, I don't know whether you can train too much, but I do think it is important to acknowledge that there are some things, such as the dissection of the true dissection, that just the haptic feedback, yes, that you will need that operative experience as well. But for the training of the component steps, just to have those internalized, so you don't have to go through that part of learning a procedure in the patient themselves, I think that's the true additive value of this model.
And in the model, is there a way you can evaluate the performance of the person doing it?
Yes, so that's what I was just referring to, the critical assessment, so the assessment form. So where you look at the effectivity of each step that you do, the sequence of what you do, how efficient you are in your movement. Where my colleague Maja Joosten previously in another anorectal model also evaluated it, looking at also the efficiency of the movements, and for your own assessment, so self-assessment, but also through peer assessment as well.
Okay,
and
so
experts.
That's the step of the study then.
So I don't know if I can see Dr. Bakia. You can't see the chatter, but the chat is lighting up with a huge number of comments. Everyone wants one of these. We finally have a link to get it. This is fantastic. This is why we're doing this. I mean, I couldn't make the EUPSA meeting. These are so far 2 huge game-changing papers that half of the world didn't see and now can see. So thank you for presenting that.